Good afternoon, everyone. In this next occasion, I want to begin by addressing an issue that is often left unspoken but is deeply affecting the lives of many of our young people: the mental health crisis among university students in Indonesia. University is often seen as a time of growth, exploration, and opportunity. Yet, for too many students, it is a period shadowed by overwhelming pressure, isolation, and mental health struggles. In recent years, we have seen a troubling rise in suicide rates among students in higher education, a trend that forces us to confront the realities of the immense pressure they face, academically, financially, and socially. And at least 3 students in several regions in Indonesia have ended their lives in the past week. Most recently, a student in Jakarta was found dead in campus yard on Friday, 4th of October. Previously, in Surabaya, East Java, a student was found dead due to suspected suicide on Tuesday, 1st of October. Then, 2 days later, a student in Semarang, Central Java was found dead, allegedly due to suicide in boarding house on Thursday, 3rd of October. WHO records that every year 726,000 people commit suicide. The number of people who attempt suicide is much higher than that. 73% of the global suicide rate occurs in the low and middle income countries. The agency also noted that suicide is the third leading cause of death for people aged 15 to 29. However, a recent study released in 2022 found that the suicide rate in Indonesia may be 4 times higher than the official data. The lack of data has hidden the true scale of the suicide problem in Indonesia. The National Crime Information Center, or Pusiknas, reported that in the period January to August 2024, the police handled at least 849 suicide incidents. This means that there were almost 4 suicide incidents per day. So, why are young people vulnerable to depression? Young people, especially students, are in the teenage phase towards adulthood, where they are required to be independent. And in a study responding to the pandemic, psychologists from University of Indonesia, Diah Indirasari, revealed that students are in the category of somewhat satisfied with their lives compared to teachers and lecturers. In another study, Azmulfa Idham et al. Conducted a study on 62 students at a college in Surabaya, East Java. The result showed that 36 students had a high tendency for suicidal ideation and attempts. And in another survey, Alvara Research Center conducted a survey of 1,520 respondents in 34 provinces in Indonesia in 2022. One of the results showed that Generation Z had higher levels of anxiety than millennials and X generation. BBC News Indonesia spoke to a number of students who had thought about committing suicide. A number of things that trigger stress are being far from family, demands to immediately complete studies with high grades, financial problem, individual college assignment, and feeling left behind by classmates. And how to prevent it? So, actually, this is the teacher's job, but also identifying which students need higher attention because they may have trauma, they may have high levels of stress in their environment. Well, that system that must be created as a response to suicide. The awareness to build a support system in the educational environment must be initiated by educational institution itself. Unfortunately, not all educational institutions such as university has a system like this or a special unit that serves students in crisis situation. And the issue of mental health and rising suicide rates among university students in Indonesia, not one that will go away on its own. It requires us as students, educators, administrators, and members of society to come together and create safe space where mental health is prioritized and where no one feels like they have to face their struggles alone. Let us remember that every small act of kindness, every conversation, and every effort to reduce the stigma surrounding mental health can make a difference. Together, we can advocate for better support system, foster a more compassionate environment, and ensure that students know that they are not defined by their grades or achievement, but by their strength and potential as individuals. It is our shared responsibility to make sure that no one feels left behind or that there is no way forward. We may not have all the answers today, but what matters is our willingness to act, to listen, and to care. So, on 10 October is World Mental Health Day, and I want to remind you that every day, not just today, 10 October is World Mental Health Day. And I want to remind you that every day, not just today, your life matters. Even when things feel hopeless and dark, don't give up. You've come this far for a reason. You have the strength to get through any inner battle you're facing. And remember, you are not alone. You have a purpose and you are loved more than you realize, even when your brain tells you otherwise. So, thank you for your nice attention, and let's continue to work together to create a future where mental health is seen as a priority and where every student has the opportunity to thrive both academically and personally.